Hello everyone, welcome to Dr. Atom. Today we are going to talk about the dark side of garlic. The dark side of garlic. Garlic is good for your body, but remember that it can also be bad for your body. Now, what is garlic? First of all, we know that garlic is an herb that is grown around the world. It is related to onion, leeks, and chilies. Garlic is most commonly used for conditions related to the heart and blood system. These conditions include like high blood pressure, high levels of cholesterol or other fats in the blood, and even hardening of your arteries. Even in fruits and beverages, fresh garlic, garlic powder, and garlic oil, these are being used like for like flavors. How does garlic work? Garlic produces a chemical called allicin. You can remember in the former video of we talk about the former video we talk about the how garlic treats hypertension or high blood pressure. We talk about that. Garlic produces a compound called allicin. This is what seems to make garlic work for certain conditions. Allicin also makes garlic smell. Some products are made odorless by aging the garlic, but this process can also make the garlic less effective. What are the usefulness of garlic, or what are the effectiveness of garlic? They are possibly effective for hardening of the artery, diabetes, high levels of cholesterol or fatty acid in the blood, and also high blood pressure, prostate cancer, preventing tick bites, like also helping people who are having ringworm, like that is tinea corporis, helping people who are having tinea cloris, that is chalk itch, and also with arthritis fruit, like people who are having those arthritis who are having tinea pedis. There is also possibly ineffective for cystic fibrosis, inherited tendency towards high cholesterol, stomach cancer, a digestive tract infection that can lead to ulcers, lung cancer, mosquito repellent, a pregnancy complication marked by high blood pressure and protein in the urine, that is preeclampsia. There are also insufficient evidence that garlic can be beneficial for some people with patchy hair loss, chest pain, that is angina, athletic performances, like taking one garlic before going for sports it's okay for you to make it to be strong during the sports, enlarged prostate, breast cancer, colon cancer, rectal cancer, common cold cones, heart disease, cancer of the esophagus, muscle soreness caused by exercise, muscle strain, build-up of fat in the liver in people who drink little or no alcohol, obesity, swelling and sore inside of the mouth, thrush, osteoarthritis, rheumatoid arthritis, hardening of skin and connective tissue, vaginal yeast infections, wound healing, a type of benign, that is a type non-cancerous breast disease, swelling of the stomach, that is gastritis, swelling of the liver, that is hepatitis, and some other conditions. Though more evidence is needed to rate garlic for these uses. Now, for us, we are talking about the dangerous side of garlic. Sometimes taking garlic can be so dangerous for your life, so you have to know whether you are fit to take garlic or not. What are the side effects? When taking garlic by mouth, garlic is likely safe for most people when taken by mouth appropriately. Garlic has been used safely in research for up to 7 years now. However, garlic can also be dangerous in some instances when taken by mouth. Garlic can cause back bleeds. This one can push you away from your flanks, a burning sensation in the mouth, a stomach heartburn, gas, nausea, vomiting, body odor, and diarrhea. These side effects are often worse with eating fresh garlic, that is raw garlic. Garlic may also increase the risk of bleeding. There have been reports of bleeding after surgery in people who have been taking garlic. Therefore, if you know that you are about or you are programmed for a surgical operation, you must stop taking garlic at least 2 weeks prior to surgery. Asthma has been reported in people working with garlic. Other allergic reactions are possible. Garlic might also cause skin damage that is similar to a burn. Raw garlic is possibly unsafe when applied to the skin. Raw garlic might cause severe skin irritation when it is applied to the skin. Also, there are some special precautions and warnings to those who are pregnant and breastfeeding. Garlic is likely safe to use during pregnancy when taken in amounts normally found in the food. Garlic is also possibly unsafe when used in medicinal amounts during pregnancy and when breastfeeding. Also, in children, garlic is possibly safe when taken by children as a medicine short-term. However, garlic is also possibly unsafe when taken by mouth in large doses. Some sources suggest that high doses of garlic could be dangerous or even fatal to children, so avoid it. The reason for this warning is not known, as even for me, it's not known to me also. There are no case reports available of significant adverse events or mortality in children associated with taking garlic by mouth. When applied to the skin, garlic might cause damage to the skin that is similar to a burn. Also, in bleeding disorder, garlic can cause bleeding disorder, especially fresh garlic might increase the risk of bleeding. For diabetic people, if you know that you are having lower blood sugar, you should avoid garlic. In theory, taking garlic might make blood sugar too low in people with diabetes. Stomach indigestions are also problems faced by people who are taking garlic. So if you know that if you are having these problems, you should avoid. If you have problem of indigestion, you should also avoid garlic because it can irritate the gastrointestinal tract. Use garlic with caution if you have this. Also, if you are having low blood pressure, you should avoid garlic. In theory, taking garlic might make blood pressure become too low in people with low blood pressure. Also, in surgery, you have to make sure that you avoid garlic before surgery because this prolongs healings and also it prolongs bleeding and also can interfere with blood pressure. Make sure that you stop taking garlic 2 weeks before you have been programmed for surgery. Now, there are also possible interactions. For example, you are taking other drugs and you think that you feel like taking garlic. You have to know that if you are taking some of these drugs that I'm going to mention, you should avoid taking garlic at the same time. Do not take garlic if you are under any of these drugs. Note, for example, isoniazid. Isoniazid is an anti-tuberculosis. It's used here. So you should not use garlic at the same time because both of them interact so much. Other medications, like medication used for HIV, most of them interact with garlic, like including nevirapine, dilavidine, and also efavirenz. Those efavirenz also, they interact with garlic. You have to avoid garlic if you're under any of those drugs. Also, sapinavir, you have to avoid garlic. Even those who are under birth control periods, you have to avoid garlic. Avoiding garlic is very necessary for you because you will not say, oh, okay, I was under this period, but it's not working. First, you have to know whether you have been taking garlic at the same time. People who are under cyclosporine, you have to do away with garlic. Medications changed by derivatives such as the metoxyfolin, also halothane, and also some allegra like ketoconazole, like triazolam, like fexofenadine. Also, you have to avoid garlic. There are some also there are some also medications that slow blood clotting. If you are taking any of these medication, you should also avoid garlic, like diclofenac, like ibuprofen, like naproxen, like warfarin, like heparin. So that is all for today. Therefore, avoid taking garlic if you know that its danger is more than its importance for you. That is what I want to let you know, that garlic can be too dangerous for your life if you think that you can use it to solve some problems. Also know that there are some problems that it can generate. So avoid taking garlic if you know that you are not a candidate for it. Thank you for today. Try to like the channel by subscribing, like the video, and also share. Thank you. Welcome once again.